They often provide the first line of care and treatment to patients in government medical facilities, and their contribution to the medical operations is undoubted. They are the greenhorn doctors, or call them the interns, who work full-time as they train for 1 year in order to attain a practicing medical certificate after their 5 years at medical school. These interns are entitled to a monthly allowance of 850,000 shillings each from government to facilitate their 1 year training. Though this money can hardly meet their costs, government has on several occasions failed to remit it, resulting in sit-down strikes from the intern doctors. With all the toil and hardship which comes with such pressures, these intern doctors have not received their allowances for the last 6 months. NTV talked to one of the intern doctors working at Mulago Hospital, who preferred to remain anonymous because of the sensitivity of the story. This is his typical day of adrenaline rush, where the intern doctor attends to patients in critical condition. He works at the ward for 7 days for at least 8 hours daily. He reveals that he's finding it hard to cope because he has not been paid his allowance for the last 6 months.
You find your landlords want money, you don't have the money. Some of the colleagues are being chased out of the houses. They don't have the basic needs like soap, things like sugar to sustain them because of the little fee. And yet, since it's an internship training, it's like you have to give it a lot of contact hours, you have to give it time.
However, his passion to save lives and the Hippocratic oath he swore to uphold keeps him going.
By the time you become a doctor, you're supposed to be very committed to the work you're doing. But of course, as a human being, nature also plays a role. Sometimes you're so hungry and your stomach is burning. Some people have ulcers, disease, you see.
Even when the going gets tough, he affords a smile. However, he feels that government has let down the medical professionals.
Even if you are a son of a minister, or you someone in a very big office around the country, you may get an accident from anywhere around the world, or in Uganda basically. And the first time they bring you to casualty, at least will be the National Referral Hospital. And these are the people who are going to see your patient.
His story is symptomatic of the frustrations of about 800 medical interns who are distributed in other far-flung areas to earn a living.
Because what we're getting is knowledge, but knowledge on a hungry stomach, I don't think it's the best.
When NTV contacted the permanent secretary in the Ministry of Health, Dr. Asumani Lukwago, he acknowledged the challenge.
I told them that we had shortage of funds just because we took up a big number of interns, and from the start we had told them that we are likely to get shortage of funds.
Lukwago, however, said that the ministry is processing their dues, which will be paid soon.
Their funds have been released. I think we have got about 1 billion, and we are going to schedule the payment maybe tomorrow.
He, however, asked them to be patient.
They should not focus on money as their primary end point. Their primary end point is to qualify and become professionals.
Prompted by the plight of their colleagues, doctors recently handed soap to over 50 interns at Mulago Hospital.
Anyone out there who earns a salary knows that if you miss your salary for 1 or 2 months, you'll be cringing with pain. So what about these ones who have gone a whole 6 months without pay? My heart goes out to them, our hearts go out to them, and that is why we have come together to show them our support and our solidarity.
Senior professionals argue that the medical intern problem is just the tip of the iceberg of a crisis which has engulfed the health sector.
If they are harassed during their training, if they feel like this profession has no value within this country, they will most definitely leave the country for greener pastures, because a health worker also needs to survive.
There have been complaints from different patients that medical workers in different government health facilities ask for money to offer services, which is of course unethical. But against such a backdrop, are these doctors really to blame? That's a question to ponder on. Solomon Serwanja, NTV Weekend Edition.